My name is Bob Fisher, Oceanside, California. Work for a cable company out here. I recently injured my back at work. I thought it was something part of an earlier incident from many years ago. Came to Dr. Was it Gorgas?
Gorgas, yeah.
Gorgas. I was barely able to walk, get out of my truck, hobble across the street, came in here. He did an in-depth question and answer thing. He took x-rays, determined what was wrong with my back, figured out a course of action over a couple of weeks. Came in on a scheduled basis. He put me on several machines. I think the best one back there is called the ATM machine. That thing works wonders. When I first came in, my pain level was 10 out of 10. Now, after less than 2.5 weeks, my pain level maybe 1. Significant. I feel better. Through work, they had sent me to something called Work Partners, where I never saw a doctor, just nurses. Been there 3 times, saw 3 different nurses. They prescribed Vicodin, muscle relaxers, and naproxen. I took the Vicodin as prescribed, but after about 2 days, I stopped taking it. I would take it at night before I went to bed. I wasn't in any pain, move around at night, wound up doing more injuries to my back, wake up in the morning, twice as much pain as when I went to sleep. So I stopped taking it. When I went back there the other day, I told him I got more results seeing the chiropractor in 45 minutes than I did taking painkillers for 2.5 weeks. So they just made a note of that.
So what would you say, Bob, to people who are injured and I mean, because you
definitely
thought you were...
come here. What I like about your office, you're not running a mill. You see one person at a time. That is the biggest difference. Where I saw one other chiropractor 15 years ago, he had 6 different patients in 6 different rooms, and he bounced from place to place. I didn't want that. On your site, on the internet, it just showed the one room. And that's why I chose you, and I came here, and that's what you've got. You've got the one room, and you see one patient at a time.
Great, thank you very much.
That's the personalization, which makes the big difference.
Right. And you found us in the internet?
On the internet, yeah.
Great. And Bob, a lot of people, you thought you were going to have surgery when you came in here, didn't you?
I was afraid I would be forced to retire. I was in that much pain that I thought I would have to quit my job and everything. Now I'm just about ready to go back to work again. So.
Excellent. Thank you so much.